Hello, I'm Dr. Pete Sedilli, and welcome to my series on happy outcomes for cancer patients. This is number 44, rectal cancer. These case reports are from the book One Man Alone, an investigation of nutrition, cancer, and Dr. William Donald Kelly, written by Dr. Nicholas J. Gonzalez, completed in 1987, published 2010 by NewSpring Press, and the research was supervised and the case is verified by Dr. Robert A. Good, the director of Memorial Sloan Kettering Cancer Center in New York City, one of the oldest and largest cancer research and treatment centers in the world. Patient 44 was a 62-year-old female with rectal cancer, and she was alive more than 5 years since diagnosis of metastatic rectal carcinoma. This case began in late 1981 when she noticed an onset of constipation with occasional blood-tinged ribbon-like stools. Her appetite diminished, and over 3 months she lost 10 pounds. In January of '82, a sigmoidoscopy revealed ulcerated lesion in her lower rectum. Biopsies revealed rectal adenocarcinoma. In February of 1982, she was admitted to the University of Iowa Hospital, and their biopsy slides confirmed invasive, moderately well-differentiated adenocarcinoma. Patient 44 underwent surgery for resection of the tumor obstructing the sigmoid colon and the upper rectum. Now, 18 out of 32 lymph nodes were positive for cancer, a very ominous sign. The medical doctors advised her that the cancer would most likely metastasize and kill her. Despite this poor prognosis, the medics strongly recommended that she continue treatment. But patient 44 knew of Dr. Kelly's work, and she refused conventional methods. In February of '82, she began the full Kelly program of nutrition, detoxification, and pancreatic enzymes. Over several months, she gradually regained her strength, energy, and sense of well-being. She remained in excellent health until late 1986, nearly 5 years after the diagnosis. And then nausea, anorexia, and indigestion came on that worsened throughout early 1987. In April of '87, she was admitted to Des Moines General Hospital for emergency surgery. She needed a correction of acute intestinal obstruction that resulted from scar tissue that formed after her original surgery in 1982. So at the time of this research, patient 44 was recuperating from the surgery with no signs of any cancer. Now, the prognosis for rectal cancer, once metastatic to multiple regional lymph nodes, is dismal. And according to the textbook, Cancer Principles and Practice of Oncology, lymph node involvement is the most important prognostic variable for colorectal cancer, with a chance of survival decreasing as the number of affected lymph nodes increases. Copeland, another author, and his colleagues describe a 10% 5-year survival rate for colorectal cancer patients with at least 5 cancerous lymph nodes. These are patients who had surgery and aggressive chemotherapy and radiation, or both. Now, patient 44 had 18 cancerous lymph nodes, so her long-term survival and freedom from cancer are extraordinary. So when last contacted, she was recuperating from a recent surgery, which was related to the previous treatment, and she was determined to continue Dr. Kelly's program. Here we see how under conventional cancer treatment, the patient faced pain, misery, and certain death. Then they chose a non-toxic alternative and got a much different outcome. Their health was restored, and they lived and enjoyed life far beyond all predictions. We must remember, the cancer industry is focused on shrinking tumors and not on restoring health. We know that conventional cancer treatment is risky. Chemotherapy and radiation themselves cause cancer. Surgery and biopsy spread cancer by releasing circulating tumor cells. So instead of all that, we work together with you to restore health so that your body rids itself of cancer. Now it's time to think about the people who love you, the people who depend on you, the people who want you around, and how important you are, and ask yourself, are you doing everything possible to recover your health? To optimize health and defeat cancer, we must establish 6 fundamentals. Number 1, we need an optimal body pH. That's the acid-alkaline balance. Your body pH must be in the right zone in order for digestion, immune system, and all other biochemistry to work properly. We must balance hormones. We're in an epidemic of hormone-related cancers. Breast cancer, uterine cancer, ovarian cancer, prostate cancer, testicular cancer. Well, Dr. Kelly wrote that he felt that it was excess estrogen that triggers all cancers. We must detoxify the body, mind, and emotions. We're in daily exposure to thousands of toxic chemicals that were not around 100 years ago. And most of us carry toxic thought and emotional patterns that block healing. Detoxifying all 3 is critically important for every cancer patient. We must eliminate infections. Now, cancer often shows up when the body is exhausted from fighting chronic infection and inflammation. For example, the leading cause of liver cancer is chronic hepatitis C. Now, you may have chronic and untreated infections that you don't even know about. We must rejuvenate depleted organs, glands, and systems. The biggest single risk factor for cancer is aging. And folks, that means everybody that's 40 and up. Over time, our body is depleted of essential nutrients and enzymes, so that normal systems break down and chronic disease and cancer take hold. Then we must use the best proven cancer-fighting natural methods. There are natural methods that are proven to turn off and kill cancer cells. And we work together and determine which ones work best for you. Unfortunately, chemotherapy and radiation make all those important health factors worse. Not good. So we come back to this. I'm not going to be your MD or your oncologist. Those treatment decisions about chemo, radiation, surgery, those are between you and the prescribing doctor. But I will work together with you to restore health so that your body heals itself. These patients in my Happy Outcome series, they had the courage to take their fate into their own hands. They did so in spite of opposition from MDs and in some cases opposition from their families. And they enjoyed recovery and health completely outside anything seen in conventional cancer care. Ask yourself again, are you doing everything possible to recover your health? Then call my office, 907-272-6299, and make an appointment. I look forward to seeing you, and I look forward to changing your life for the better. Thank you. I'm Dr. Pete Sedilli.